Hey y'all, I'm gonna go over your vocabulary with you. Alright, so I'm gonna start with abuse. You may have to stop the recording to write notes or make corrections as you need to, so feel free to do that. Remember, this is always posted on YouTube, so you can always watch it later. But I expect you to follow along while you're in class. Okay, abuse. Incidents or practices by a medical staff that is not usually considered fraudulent, which are inconsistent with accepted sound practices. This is where people do things over and over again and they don't have to. We I'll talk a lot about my old job. They did a lot of shady stuff, and I had the unfortunate experience of having to testify against them at a federal court. I was subpoenaed, the whole nine. It was not fun. But they used to do things such as abuse and fraudulent activity. And one thing that they used to abuse was muscle testing. Muscle testing they would do every other week. We didn't need that done every other week because in a re-exam, the doctor does the muscle testing. So that means that you're getting 3 muscle tests out of one patient in a month. That's excessive, and it was not needed. Alright. Civilian Health and Medical Program of the Department of Veterans, CHAMP-VA or CHAMP-VA. It is a program that provides health benefits for dependents of veterans when the veteran is 100% totally and permanently disabled as a result of military service, veterans who died as a result of active service. Clinical Laboratory Improvement Act, CLA. Congress passed in 1988 to establish quality standards for all lab testing. Consolidated Omnibus Budget Reconciliation Act of 1985, Cobra. It allows employees to contribute health care coverage beyond their termination date. So what happens is if I decided I didn't want to work for Alden anymore, I can continue my healthcare coverage upon my termination or upon me quitting. The thing about Cobra is it's 3 times as much as your normal fee schedule that you will pay for your healthcare expenses. Now, for example, my husband, when he worked at Fox, his coverage for both me and him was $90 a month. So that was $45 a pay period, which is really, really good because Fox picked up the majority of the cost on the insurance. Well, if we paid $90 for a month and we multiplied that by 3, that's what we'd be paying when he decided to quit. If you can imagine somebody that it's already $1,000 for them to cover their entire family, multiply that by 3, then you're talking about $3,000 a month to continue healthcare coverage. Now, Cobra can last as much as you want, 3, 6, 9, up to a year. Copayment or copay. The amount an insured person is expected to pay at the time of each medical visit. Deductible. We talked about this when we talked about the types of insurance. It is the amount the patient is responsible for before the insurance policy pays. Excuse me. Fraud. Intentional misrepresentation of facts in order to deceive or mislead. Going back to that court case that I had to testify against. In my office, I had a standard in which my employees had to follow. I worked for a company, so I was an employee, but I had employees under me. And I explained to them that there's a certain way that you do things and there's a certain way that you don't. The office across town, however, decided that they were going to not do the right thing. They would write down that patients did certain services and they really didn't. They came in and they would just sit and watch TV and then they would leave. That's fraudulent. That was a complete misrepresentation of what was actually done. And for that, those individuals are now serving 10, 25, and I believe 30 years in prison. And yes, I sang like a canary. Don't ever let somebody put your livelihood at stake. Excuse me, y'all, my allergies are really bothering me, so I apologize for the way I sound and me continuously sneezing. Alright, a subpoena is a writ requiring the appearance of a person at a trial or proceeding. Now, yes, when you see it on TV, it looks real cool. You've been served. It really doesn't happen like that. It's not that dramatic. The person who came and the officer that served me with my subpoena, he actually called me and he said, I have to come and serve your subpoena. Would you like me to subpoena you at home or at work? I didn't care which way he did it, but he at least let me know. It wasn't a shock. And he said, I just have to read you your rights, letting you know that you are required by law to attend this proceeding, and if you do not, we can come to your job at that point and arrest you and force you to testify. That's pretty much what a subpoena is. But as far as what you see on TV, it is not like that. Not at all. Authorization. An individual's formal or written permission to use or disclose his personal identifiable health information for purposes other than treatment, payment, or healthcare operations. Clearinghouse. A clearinghouse is an independent organization that receives insurance claims from the physician's office and performs software edits and redistributes the claims electronically to various third-party payers. So how it works is that you're going to have the physician's office or the hospital, and in the middle you have what's called a clearinghouse. The clearinghouse is going to check those claims to make sure that there aren't any mistakes. They're going to check the social, date of birth, the spelling of the first and last name, middle initial, all of those things. If there's a mistake, it will ding and send back to the physician's office for it to be fixed. Now, does the clearinghouse always tell you what the problem is? No. Sometimes you have to figure it out yourself, and you might have a nice one. They might say, oh, you need to fix the date of birth. It doesn't match our records. That's not always the case. A lot of times they'll just send it back, oh, this is wrong. Fix it. We're not paying you till you fix it. And that's how I'm saying it is how I feel when I receive a denial. Because they don't always tell you what the problem is. But again, it is a checkpoint. So you're going to have the doctor's office, hospital, send out the claim. The clearinghouse receives it, they double check it. If it's correct, they'll send it on to the respective insurance company, whether it be United Healthcare, Medicaid, Medicare. That's the third party. Okay? Compliance. The process of meeting regulations, recommendations, and expectations of federal and state agencies. The main or the largest compliance agency is Joint Commission, and it's known as JCO. That is what regulates your hospital compliance. With your nursing home, there's the Texas Department of Aging. They will go in and regulate. There's another department, I think it's DADS, that they regulate nursing homes as well. But all facilities have some type of compliance that they have to follow. Consent. Consent is a verbal or written agreement that gives approval for an action, situation, or statement. Standard, rule, condition, or requirement. Transaction. Transmission of information between two parties to carry out administrative or financial activities related to health care. Personal injury protection, PIP. We talked about this in your types of insurance. It reimburses medical expenses for covered individuals regardless of fault for treatment due to an auto accident. It pays for funeral expenses, lost earnings, rehabilitation, and replacement of services such as child care if a parent is disabled. Now please note that if you are the passenger of someone that has PIP, their PIP will cover you, and if you have PIP on your personal car insurance, your PIP will cover, so you are double covered. Disability insurance. It's reimbursement for income loss as a result of temporary or permanent illness or injury. Disability insurance paid only if individual is unable to do regular or customary work for a certain number of days, was employed when disabled, was under the care and treatment of a licensed provider during initial disability, and continues care with the same. Processes a claim within a certain number of days after the date the individual is disabled, and has the licensed provider complete the disability medical certification documents. Now I'm going to go through this as if since it's me, because I filed for my disability insurance. I qualify because number one, I am unable to do my regular job because I was cut open. I had a C-section. So I'm unable to lift, push, pull for a number of weeks. Was I employed when I was disabled? Yes. I am employed by Aldi ISD, so I do meet that qualification. I am currently under the care of my OBGYN, and I am still under the care of the same doctor. I just filed my disability paperwork or claim yesterday, and I have 5 days before I have 5 days until my claim will go unanswered for my doctor to fill out certain documentation. And then 5, the medical certification, my doctor will state that I had a C-section, I'm off for 8 weeks, my restrictions, no pushing, pulling, lifting, over 10 pounds, basically to certify that I'm not lying, because people do lie in order to get a check for or from their disability insurances. You can have multiple policies, and there's no law saying that you cannot, depending on what your coverage is. I still don't remember what mine is. It's either 50 or 60% of my salary, and you get paid that every week. Now, I recommend disability insurance for the simple fact that if you don't have savings, or if it's an accident and you're not able to work, the supplementation will assist. The supplementation will assist with the bills or any expenses that you may have. So highly, highly recommended. AMA is the American Medical Association. It is a medical organization for medical professionals and medical students which promote continued education and shared ideas. The reason why the AMA is so important is because a lot of the standards that we have today were created and established by the American Medical Association. CCI is the Correct Coding Initiative, developed to detect improper coding claims through the use of computer edits. Now yes, the computers will catch codes that you shouldn't be using, especially if it doesn't match a CPT with an ICD-10. Yes, it will catch that. But you as a billing coding specialist, when you're inputting that information, if you see a doctor using a code they shouldn't be using, it's up to you, it should be up to you to correct them. Just because they're a doctor doesn't mean they're not human. You can tell them, Doc, you know, we shouldn't be using this code, this one is better, it keeps us in better compliance. That's okay. There's nothing wrong with that. And I can say that because I'm an anomaly. I'm a doctor that knows how to code, and I'm a doctor that knows how to bill out. Mainly because I had a mentor that said, if you want to get your money, then you better know how to get it. And I didn't understand what that meant until I actually worked in the claims department. And there are a lot of doctors that do not know how to bill out on their own patients. And so they get in trouble because they have people billing out information wrong, and they don't understand what codes mean. So I would recommend anybody that even if you're continuing your education on the other side, that you know how to bill. So this will help you in the long run. HIPAA, you should all know what that means. Health Insurance Portability and Accountability Act. The NHII is the National Health Information Infrastructure Initiative to set forth to improve patient safety and the quality of health care, and to better inform individuals about their own health, and to help them understand healthcare costs. NPP, I went over this on the other day with your activity. Notice of privacy practices. These are the rights of the patient. HL7 is Health Level 7, a standard developing organization whose mission is to provide standards for the exchange, management, and integration of data that support clinical patient care and the management, delivery, and evaluation of healthcare services. This is like a baby HIPAA. HIPAA is on a big scale. If you violate it, you go to jail, lose your license, stuff like that. This is not as bad, but it's a baby HIPAA. It's along the same lines, just on a smaller scale. PHI, Protected Health Information, your demographics, name, address, phone number, stuff like that. We talked about this on the other day during your activity. DRG codes is diagnosis related group and or drug related group, so please make sure you write both of those down. You already have CLA, you already have copay, and then third party administrator is the person or the company that's paying for you. So car insurance, health insurance, that's a third party administrator, CPA. Alright, so that is your vocabulary. As always, if you have any questions, which you guys are really good at, if you have any questions, feel free to email me. I might not be able to get to you as soon as I can, but usually I am available during your class period, just so you can see what you're asking and I can give you an answer. But till then, y'all stay blessed, and I will talk to you guys soon.